Welcome to Wonder Hair Career Institute Online. My name is Levina and I will be your instructor for today. Today we are going to talk about measuring and recording pulse. On that day, your instruction card will read like this. You are asked to take the radial pulse at the wrist. The pulse should be counted for 1 full minute. A measurement form is provided to record the resident pulse. The role of the resident is played by a person. So on that day, you're going to do this skill on one of your students that came to take the exam also. What is pulse? Pulse rate. Pulse rate is the number of times your heart beats in 1 minute. Pulse rate varies from person to person. Your pulse is lower when you are at rest and increases when you exercise. Let's read number 3 of our checklist. When you're taking the patient's pulse, you want to support resident arm in a manner to avoid dangling while pulse is taken. Use fingers, not the thumb, to take the pulse. Why? Because your thumb has its pulse. You don't want to count the pulse of your thumb instead of counting the patient's pulse rate. Place fingers on wrist at radial pulse to measure pulse rate. Count pulse for 1 full minute. Record resident pulse rate on measurement form within plus or minus 4 beats per minute of nurse's measurement. So when you finish your skill, remember you must wash your hand before you record. So the recording form is something like this. Remember, pulse is beats per minute. So the form here, it has where you have to put your reading, and it says per minute. So we want to make sure if it's 60, you write 60 beats. Already they have per minute here for you. So you sign your name. Don't forget this. Remember, you must wash your hand before you document. Normal adult pulse rate is 60 to 100 beats per minute. If you measure your resident pulse and you get anything below 60 or anything above 100, you need to report it to the nurse. Do not use your thumb. I said it earlier because it has its own pulse that you may feel. When counting a resident pulse, the nurse aide should notice if the rhythm of the heartbeat is regular and then count for a whole full minute. Now, we don't have much to talk on this pulse, but let's ask one of these questions. Question: the heart is an important muscle for which of the body system? Circulatory or cardiovascular system. Which of the following pulse reading will you report to the nurse? If the nurse asks you to take the vital sign of your resident, what pulse rate will you report to the nurse? You must know the normal range for adult pulse rate, which is 60 to 100. So if you get anything below 60 or anything above 100, you want to make sure you report it to your nurse. When we are taking the radial pulse, where is that radial pulse located? Is it located on the ankle? Is it located on the foot? Is it located on the groin or the wrist? It is located on the wrist. And when you're taking this pulse, you want to put your fingers towards the thumb side of your wrist. That's where you feel the radial pause. I hope you enjoyed this little tip. Thank you for watching. If you do enjoy this, please subscribe and hit the notification button. Good luck in your exam.